awesome, and welcome back to Dr. Brian Evans. Thank you so much for coming back in to talk about things here. We're very, very happy to have you. Now, neuropathy is a very specific kind of pain. Right? And it's not always from diabetes, but that's a common place that we see it, right?
Diabetes, smoking are all big risk factors for developing neuropathy or neuropathic symptoms. And what we at CIC are really looking for to see if that neuropathy is due to poor blood flow into the legs, because then we can really address that and improve that flow going to the legs to hopefully improve the amount of oxygenation.
Is it more often to the legs than the arms? It's all extremities?
It's all extremities, but what we are really focusing on are into the legs, because with diabetes, high blood pressure, smoking, with neuropathy, the neuropathic symptoms may be just the tip of the iceberg of what's going on there. So we want to address it quickly before those symptoms can develop into something worse.
And it's not always medication that solves the problem. There's some simple ways to kind of alleviate your pain, right?
Yeah, medication is not the answer to all this, and some people that do start on the medication don't respond to it or actually don't like the way it makes them feel overall. Some things that patients can do to improve if it is indeed due to poor blood flow: walking, exercise, diet, and controlling your blood glucose levels if you're diabetic. All of these are really strong things to improve those symptoms.
So even if you have pain in your legs, you should be walking on them.
Our bodies want to move, so keep them moving.
Yeah, okay, all right, because it seems like sometimes you wouldn't. Does anybody have any questions about neuropathy?
Occasionally I'll wake up in the middle of the night because of pain in one or both of the heels, just the heels of my feet. I don't have any idea what that is.
Well, Charlotte, that's a great question, and actually that's the answer to a question we commonly ask in our consultations is, do you develop any pain when you lay down at night? Because sometimes that can be an indication of poor blood flow going to your legs, whereas when you lay down and horizontal, you no longer have gravity working for you to pull the blood flow down into your feet. So once you're flat, that gravity goes away, and then people develop either pain or odd sensations in their feet.
So how do you know when it's time to come in and find an expert on it?
If you're having these sort of symptoms, just seek answers to it and talk to your primary care doctor or contact us directly, and we'll get you in and evaluated.
Good enough. Thank you so very, very much for joining us today, Dr. Brian Evans. Thank you so much.